And welcome into Jmore's new JBiz Health Innovation Series featuring accomplished leaders in healthcare who are developing and using innovative approaches for healthcare. I'm your host, Gary Stein, and the JBiz Health Innovation Series is brought to you by our good friends at Nemphos Braue, the Mid-Atlantic's leading boutique corporate law firm supporting corporate growth at every stage of business. Nemphos Braue specializes in corporate, business, startup, and entrepreneurial law, and their team has extensive experience in the areas of intellectual property, mergers and acquisitions, and general counsel practices. Nemphos Braue is also committed to providing timely information regarding state and federal programs to assist businesses during these difficult times. And they continue to update information as it becomes available. You can check them out online at nemphosbraue.com. Braue is spelled B-R-A-U-E. I can't overstate the importance of today's topic in our podcast. Today, we are dealing with the two great epidemics of our generation that are intersecting in ways that are absolutely deadly, and would highlight the urgent ways that we must respond to some of the underlying fault lines in our society that are worsening both crises. And of course, I'm talking about COVID-19 and the opioid crisis. Addiction. A couple of stats for you. While the United States represents about 5% of the world population, it consumes 80% of the global opioid supply. And almost 21 million Americans today have at least one addiction, yet only 10% of them are after treatment, receiving treatment. How has the problem become so pervasive, and what can we possibly do about it? Well, joining me for this discussion today are two gentlemen, as you can see, Mark Gold and Michael Silberman. Mark is a co-founder and chief executive of Amatus Health, a nationally accredited leader in substance use and mental health treatment. Mark is on the left, the far left. Michael is a co-founder and the chief operating officer. Amatus Health is growing now with 13 facilities in 6 states and in the District of Columbia. Gentlemen, welcome to you both, and thank you for making the time.
Thank you. Thanks for having us.
Absolutely. Mark, I'll start with you for the moment. Those numbers that I just cited, the statistics about opioid addiction, I mean, astonishing to somebody who doesn't know. You guys are in it. What are your thoughts? What are your reaction when you hear that?
Thank you, Gary. The numbers are definitely staggering. It continues to be staggering. Here at Amatus, part of our, our passion, at least for what we do every single day, is we're part of addressing the unfortunate, staggering numbers that we see. As far as what you indicated, earlier as to how we got to these staggering numbers, I believe that in late '90s, pharmaceuticals, the use of
the pharmaceutical drug industry really took advantage of a very vulnerable population, and what ended up happening is the result that we have now. It's insane to hear those numbers, especially when you compare them to the other parts of the country. But we see it every day, and we're now seeing, almost like the baby boomers back in the day, the results of the generation gap of the pharmaceutical abuse, and now coming out with really, people in their 40s, 50s. We see a number of people in that age bracket, and then also their children, because it's a generational disease, and it continues to grow. It's
the use of prescription drugs back in the 1990s. The pharmaceutical companies, was telling the medical, world that it's not something that is easy for the patients to be addicted to. And then unfortunately, over time, we saw that it was completely not an accurate statement. And now, like Mike had indicated, we're trying to go ahead and reverse that. So as far as, being generational, putting out, more treatment could go ahead and at least address those that got into it. And as well as the pharmaceutical companies are now addressing having a lot more less use. When going to the doctor, you're not going to get anything that has opioids. They're going to give you something else, and at least measures and steps before you need to go ahead and take something as strong as that. But
so that addresses the opioid addiction specifically. But Michael, your comment, now you put on top of that the COVID-19 pandemic. Last 3 months, we've seen what's happened in this country and worldwide. The intersection of these two, what do we make of this? What's the result here going to be?
It was a perfect storm, unfortunately. You take one crisis that's been around for decades, you take another pandemic that's now caught everyone off guard, not only from a personal standpoint, but a financial standpoint. When you have a triggering event for somebody, those triggering events typically are what drive them into addiction in the first place. So now take somebody that may have had a problem and you have financial difficulty. You have uncertainty with their jobs. You're stuck at home managing childcare. Now you're a teacher all of a sudden because you have to have homeschooling done. all these different things. Family. I mean, family is tough. We all love our families, but a lot of times family can be a big trigger in and of itself, dealing with different personalities, etc. And all of a sudden you have liquor stores delivering, right? You can't find graham crackers at the grocery store, but you can get booze right to the house. It's crazy. So it's been this whole perfect storm between COVID and the opioid pandemic. We've seen literally at this point a 22% increase in admissions. It's unbelievable. I'm very grateful that we have space available for people, but at the same time, I wish that we were out of business. I would very happily find another line of work if this thing could go away. And the unfortunate part is when you intersect both of these pandemics, it's been, like I said, the perfect storm for somebody relapsing.
So while we're on this topic, and before we backtrack and get the background of your stories and how you came to telehealth is now a very hot topic, and not even a topic, but an actuality. It's always been around, but now with COVID, it's even more important. We had a doctor from LifeBridge Health a couple of weeks back talking about it. How has telehealth, to either one of you, how has telehealth affected, or how have you used it in your practice?
We're very grateful because the telehealth services, like you had mentioned, have always been around, but there's a lot of restrictions also from the different insurance companies, Medicaid, et cetera, on how you can actually use that service and bill for it, et cetera. To their credit, they loosened their regulations during the pandemic and allowed places like us to be able to utilize telehealth services so we can keep our clients and our staff safe in a very, very controlled environment, but also continue to allow them to get the treatment services that they need. So a lot of our clients are staying at home or in a sober home, and they're getting their services that way. The medication and things like that through the R&Ps, medical staff, that's also delivered via telehealth. So we are grateful for them, but also for our staff to be able to pivot in such a short amount of time. I mean, you're talking an entire organizational structure pivot that had to take place in a matter of weeks. We're in a position where we deal with, a highly volatile clientele and census. We needed to make sure that they felt safe at all times, but we're also able to have that continuum of care when it comes to the clinical perspective. And we were able to do so very quickly. So we're very, very happy and grateful for the technology and for the team.
We're talking with Mark Gold and Michael Silberman. Mark Gold is the CEO and Michael Silberman is the COO, the Chief Operating Officer for Amatus Health, a growing concern, both now 13 facilities in 6 states and the District of Columbia, dealing with substance use and recovery. We'll talk about recovery in a moment. But and we also are brought to you by Nemphos Braue. They are the JBiz Health Innovation Podcast sponsor. Nemphos Braue, a leading boutique corporate law firm supporting corporate growth at every stage of business. Mark, let's backtrack a little bit and get the backstory of yourself and Michael and Amatus in general. How did you get here? What motivates you to do what you do every day?
Thank you for that. So I'm going to answer that question in 2 ways: how I got here and how I got into the space specifically. So as we know, addiction is not discriminatory. It's every single household, every spot on this earth. With myself being one of the lay leaders in our community, we had an initiative to go ahead and to search out options and programs to bring education as well as program options into our own community. And that navigated to me, our third partner out of Florida, Baruch, who have childhood friends. We had the same initiatives for both our communities. And then we came across Mike. Once we collaborated together, we identified that our conviction, passion to bring treatment within the communities that until now was sort of shunned, that it wasn't an issue, and it took time to let everyone know that this is impacting everybody equally. Once we went ahead and really identified that we're on the same page, our story is still being written, and here we are. Fast forward. At least addresses some of the history of how we've gotten together. Once I was able to go ahead and to really get familiar with what is and what it is that we do, providing opportunities for those that are looking for recovery. This is what keeps us going every single day. There's nothing greater than to come to work, have a career, but it's a career that ultimately helps other people.
Mm-hmm. And Michael, for you, I know, and we're coming today from Baltimore, Maryland, just outside Baltimore. You are a Baltimore area native, grew up in Owings Mills, etc. What's your story, and how did you connect with Mark and come up with what you're doing today?
Sure. I learned a Yiddish word when we met. They said it was beshert, which means to be. I did not know what that meant, but that's the short version. I am from Owings Mills. I went to Owings Mills High School, and I'm in recovery myself. God willing, on July 28th, I'll celebrate 15 years of consecutive sobriety. And my story. Thank you.
Yeah.
It's interesting because I come from a very, very good household. My parents are still married. They still hold hands. There's no addiction in my family, but addiction does not discriminate. And that's my story in a nutshell. Once I was able to establish my life again and find recovery, I always had a passion, of course, for giving back. That's what we do in my own 12-step program, my own fellowship. And when I was able to take the creativity of business and convert it into something that I'm passionate about, it was like an explosion. I'm very grateful because when I met Mark, he lived in Pikesville. Shared, right? I was in a different state. I had been there for 11 years. I met Baruch through mutual friends, and our visions aligned and everything worked out exactly how it was supposed to. I believe that we were all meant to meet in order to grow this organization the way that we're growing it.
I totally believe it. Right. Very familiar with the word bashert. I believe that's how I met my wife. So I think we share that. I think we share that in common. 3 years now, you guys have been in business, if I'm not mistaken, 2017.
Feels like 30. Sorry.
Especially over the last 3 months.
Yep.
But growing tremendously now, 13 facilities, 6 states, District of Columbia. Mark, what are you seeing now in the industry, in the business, that maybe you didn't see in 17, or how have things matured in 3 years? Higher than your expectations, or what exactly?
Let me process that. So to us, what's different, I think, from recovery or putting out facilities to help those in recovery, what's different today, what might have been maybe 5 years or prior, is the acceptance of communities, understanding that this is something that they need to bring into their community. They need to go ahead and expand the treatment and the availability of treatment that is out there. So that's been primarily, I believe, a struggle for anybody in recovery looking to give back and opening a facility. Is no community, oh, that's not for us, we don't want that here, or at least even from a leadership to identify and to go ahead and to help with the resources or the barriers to allow treatment. Once now, of course, there's the opioid crisis and everybody's aware of it and it's no longer tucked under the rug. We now are seeing communities understand. They're seeing it. They're seeing their own family members. They're seeing it in their household like they've never seen it before. That, along with the grants that are out there, as well as just every state and the initiatives that are coming down from federal down to state, is allowing has removed the barriers of us and individuals like us who want to go ahead and expand the services and the footprint, allowing us to go ahead and really go there. So what's interesting is that, yes, our appetite for growth and our passion to go ahead and to make sure that there is treatment for everybody and anywhere is definitely great. But now we're being invited. So some of these locations that we're going into, it's lay leaders reaching out and saying, hey, we don't have anybody. The nearest treatment opportunity is 2 hours away and we need something closer. Please come help. If we were to go ahead and have the ability to address everyone's needs, then we would likely already be in 50 states and within the states in multiple different municipalities.
Right. So along those lines, then, you obviously do need to manage your growth, find the next area for you guys to be in. Michael, how do you go about doing that? What's your approach right now?
Sure. We usually look at 3 different sets of criteria. It comes down to staffing first and foremost. We need to make sure that we are staffed appropriately, that the clinical modalities that we set out are always uniformed, and that we can actually perform the things that we say we're going to do. Finding that niche network of people in that area is of the utmost importance. We don't like to get involved anywhere unless, as Mark eloquently put, that we are either invited in or that the community surrounding that area understands addiction and understands the need for services, for mental health, etc. The other part is we need to make sure that there's some sort of financial viability to the company in and of itself. And then, of course, is there a need? We look at the geographic location and we say, is there a problem here? Is there a need in the area? The unfortunate part is we have yet to find an area where there has not been a need. So that part usually takes care of itself. And that's typically how we look to manage the growth. At this point, we are no longer seeking locations. They've been seeking us. A lot of times it's kind of managing the opportunities to figure out, does this check all the boxes? Is this something that we want to move into this area? And how can we really help the community in a way that it isn't being helped now? So it's funny because in the beginning you look at trying to get involved in places, and now we get to manage ourselves in a way to say we can pick the communities that need it the most, that we have staffing in, et cetera. It's a unique twist that's happened in the last couple of years.
And it's happened really all in the last 3 years since 2017. Let's move ahead to what you guys do and what you're trying to help people with. And that is the curse of addiction. I call it a curse. I don't know if that's the right word or not, to be honest with you. But what can you tell us about it? What are some of the underlying factors? Perhaps what is the leading indicator of addiction in your opinion?
So it depends. And that's a great question. And the answer is very subjective. If we could pinpoint one reason why someone was an addict or an alcoholic, we would have a much different conversation. The reality is, and I always like to tell my story because I'm a very non-typical case, statistically speaking. Addiction is genetic. Alcoholism is genetic. A lot of times it runs in the family. There can be a lot of environmental background factors. If someone had abuse, sexual abuse, mental abuse when they were a child, of course, those things can lend to somebody wanting to get involved in something. You know, my background was different. I was never beaten. I had no abuse that you could speak of. There was no alcoholics in my family. And yet I still have an addictive nature. And I believe that I have the disease of addiction. So it doesn't discriminate based on sex, race, identity, any of that stuff. But once it takes place and it takes hold, it's no different when I talk to people about someone that gets type 2 diabetes, right? Type 1 diabetes you're born with. Type 2 can be developed. Now, there may be factors in somebody that if you are prone to type 2 diabetes, it runs in the family. Maybe it's an eating or health issue. But whatever the case may be, a certain point in your life, you cross that invisible line, and now you're diabetic. And once you become type 2 diabetic, you are always going to be diabetic. And it can be medicated with medications. It could be subsided with dietary restrictions, and it can be helped. But you're still diabetic at the end of the day. And addiction is the same exact way. Once that line in the sand is crossed, my belief, of course, is that you are now someone who is an addict or an alcoholic. And it can only be treated with therapy, clinical supervision, and ongoing treatment, whatever that looks like. For me, I have 12 steps and recovery. But it doesn't have to be that way. People can find recovery in a lot of different ways. And we don't necessarily shove one modality down someone's throat. It's very individualized. But at the end of the day, we don't know exactly why it starts, but we do know that it happens. And once it happens, it's how can we treat it in the best way possible to try to give somebody success.
So what I'm hearing from you, Michael, and Mark, please chime in as well, is that one of your approaches, if not the overall approach, is really a customized type of recovery process for really any individual that may come to see you. It's not necessarily one way to do it. It
has to be. You get so many people from different walks of life. It has to be.
Yeah, it's custom tailored. It's unique to each individual based on their needs. The analogy I use is acne cream. You know what I mean? As a teenager, right? All of a sudden,
right, we all did.
Individual, like, oh, they ran to the store and they're using it and it just doesn't work. You know, so each individual has its own different case. And within the word, you know, addiction and the disease of it, there's, you know, any assortment of things that have triggered it, and there's an assortment of customized tailoring that requires to go ahead and address it.
Is it possible to not know you're addicted?
It depends. I mean, you know, we talk about pharmaceuticals, for example. Some people start with a sports injury or a normal basic medical condition that is very, very valid. And at some point, the body gets addicted. Opioids are highly addictive. And that's what one of the biggest issues that Mark spoke about earlier is you have Oxycontins that were distributed like vitamins. And all of a sudden you wake up one day and you're sick and it feels like you have the flu and you don't know why. You're not sure what's going on. But all of a sudden you take that pill and you feel better.
Better, yeah.
The body is physically addicted. I think that happens to more people than they even realize. I think for some other people, I am like myself, I treated my own feelings and my inability to cope with the world through a substance. And I found that substance to be my relief. And then eventually I crossed the line where I became addicted. So addiction is so subjective in that way that I think that people could be addictive or addicted to certain things and not even know it yet. And we go back to prescription medications as the biggest source for a lot of that stuff, where they may be taking it for the right reasons, but eventually the body becomes addicted to those things and they need to get off.
Right. You know, me being a parent, I've got 2 kids in their 20s, thank God, doing well. But parents are always trying to be vigilant about their children and their loved ones in general. what would you say, or what are some of the signs of addiction potentially that somebody may be on the lookout for to signal that this is where they are?
There's a lot. So it depends. And the tricky part is sometimes it could appear one way and be something completely different. I know for me, it was no more communication. It was no more honest conversations, reactions, anger, a lot of things that were very fear-based and would come out very quickly in a snap of a finger. Of course, if there's theft, if money is missing, things like that, late nights, lying about where we're going, etc. It depends on the generation, right? It depends on the age group. When it comes to kids, especially in high school or in college, it could be a lot of excuses being made for things, but that's very general. Lethargy, if someone is tired all the time, or up, depending on the substance that they're using. Drastic shifts in behaviors is the big one. Thank you for that. Behaviors is what we like to focus on a lot when treating the addict. A lot of times, an addict or alcoholic uses the substance to change their behaviors. And that drastic shift in behaviors or actions is usually a telltale sign for things that are changing. For my mom, it was there was no more spoons left in the kitchen. And that was a big trigger. What's going on? So it could be a variety of different things, but I think the behaviors is going to be the most commonplace way to tell that something is off.
Mark, what would you say to someone who is reticent to come forward with their addiction? Perhaps they're ashamed or they're in denial or, anything that is preventing them from confronting it.
Acceptance. Right now, what we're working on as far as, again, giving back to what we're doing is not only we're treating the clients that are coming into our care, but we have educational programs where, we were going to roll out. I'm not sure if school is opening this year, but as far as rolling out educational programs that we offer the teachers to be able to identify, potential individuals that might fall and slip into to drug use. But I think, for me, and at least speaking as a parent now, is the ability to just communicate, with my children, let them know it's always going to be safe to let me know anything and everything. And the stigma around, drug use or as a parent just being triggered, what are you doing, and being very negative about it. This is that relationship between anybody from a child, a spouse, a cousin, any family relative member is that they cannot go ahead and say, hey, I think I have a problem, because they're scared of that initial response to be, to be looked down upon and not being accepted. So acceptance is, I think, where it starts from. And what we've seen, at least with some of the programs that we've rolled out for educational, is the more education we give a parent, or a community body, the more they're able to go ahead and where they do see something, not to have the negative response to it, but more of a positive, response to it, where, they're treating it with respect, not like, oh my, what are you? Who are you? Why are you doing this?
Right. Mark, let me pick up on that. You were just talking about like the education programs. So like, how do you deliver those programs? Do you actually have something in the schools for the teachers? How do you get it out there?
So we have a couple of different things that some of them are in the works. Mike Gimble, Straight Talk with Mike Gimble is one of our, programs that we sponsor, which is, he does his thing, not only on the segments, but in addition to going ahead and speaking in schools. That's one area of educational that we work on and we're continuing to expand. The second is that we, in each community that we exist, we reach out to all the schools offering our own, our own staff who just want to give back and really get in front of the student body and just let them know, hey, here's my story. Don't go down that path or choose a different path. In addition to coming up with, we're working with, Baltimore County with rolling out the school program as far as what they're looking to do, which is of course educational, but from a curriculum for the teachers, what we are working together in conjunction with a couple of our staff as well as Mike Gimble is to put together something that we would encourage every single school body to ensure that each one of their teachers goes through this curriculum, gets educated, and is able to go ahead and be the first sign with anybody within their student body, what to look out for, what to go ahead and do, and how to go ahead and encourage them to get counseling and to get assistance.
So I need to add, we won the RFP bid for Baltimore County Public School Systems, and we were really excited about that, not only because I'm a product of Baltimore County Public School Systems myself, I used in my schools for a long time, but to piggyback on what Mark is saying, this is the first time in history that the schools are allowing us to send in a licensed clinician into the school and provide services to clients and students in the school system, while also offering adolescent after-school programs that we have set up in Baltimore County. So it's very exciting for us. Of course, COVID hit a month and a half after the contract went through. So we're very much looking forward to that getting rolled out. But the fact that the stigma and the way that the school systems are looking at this and understanding that from a mental health perspective and the educational piece is so important to allow a clinician to come in is unbelievable. And I'm very, very hopeful that we can roll this out in different counties and in the other states that we participate in as we continue.
Absolutely. If I may, is that middle schools, high schools, all of the above?
So right now the program is for middle schools, but only 8th grade and then high schools. It's funny because we work hand in hand. One of our partners in Ohio has a 501c3 nonprofit called Team Recovery. And what their mission is school speaking. Like Mark said, it's about choices. It's about education. It's about, it's not like the DARE program or Nancy Reagan, Just Say No. It's about more than that to understand exactly why we do things and why we have choices. And it's funny because last year he spoke his name is Matt Bell, at more elementary schools, believe it or not, than did middle and high schools. And it's a scary thought, but it's also an amazing thought that the schools are opened up enough to try to educate the students at a very, very early age about what things to look for and educate, et cetera. So that's been a wonderful program we're rolling out or looking to roll out here as well.
Michael, we don't have a lot of time left, and Mark, but I do want to get to one important objective, maybe the most important objective of what you guys do, and that is recovery. The difference between sobriety and recovery. Michael, you are still in recovery. You said so yourself, I believe. So I will ask you point blank, you haven't recovered? Like, how do you recover?
So, and it's funny because if you ask somebody in a different fellowship, they may have a different answer for you. Okay. I believe, just like my example with the diabetic type 2, I believe that I have the disease of addiction. And without treating my disease forever, I will always go back to wanting to have bad behaviors and the way that my thought process has changed. I still have a home group. I still go to meetings once a week. Now, this has nothing to do with treatment. This has nothing to do with Amatus. This is a personal recovery story that I find through a 12-step fellowship. I sponsor men. I have a sponsor myself, and it's a daily reprieve. At this point, I don't wake up and I want to use drugs or alcohol. That hasn't happened for a very long time, thank God. However, the 12-step for me is understanding the principles of how to live my life. How can I become a better husband? How do I become a better partner in a work environment? How do I parent my children? How do I wake up and change the way that I'm thinking from a negative, fearful place to a place that I can actually live a clean life and something that's positive? Treatment is the stepping stone to getting me to a place that I can recover. That was my experience. I go to treatment, I detox so I can get off the substance and give myself a shot of understanding why I am the way that I am, and then continuing that process down the road with recovery through whatever means that is.
Excellent. Mark, if I may, a final question. No matter what business we're in the same business, and that is we're all in the business of expectations. We can either meet them, exceed them, or fall short of them. My question to you is, as you look to the future, what are the realistic expectations that we can all have as a society, as a community, when it comes to this particular epidemic that we're talking about and how we treat people? What is realistic?
That's I would lay out my vision, like Mike said earlier. I wish this all went away. It's not likely that it's going to go away. I do believe that there's more treatment available now than there ever has been before, and that's not only specific to the amount of locations, not only specific to the ease of getting treatment, but just between the amount of coverage that there is with and the money that the federal and state governments are just infusing to go ahead and ensure that there is definitely treatment. If I would have one takeaway as far as why I believe that will make a significant dent is because it's no longer under the rug. The stigma has been removed. Everybody's aware of the issue, and each individual, as an individual basis, as a parent, as a school body, as a community leader, as a municipality, as a state, as a governor, as all the way up to to our president. Everybody's aware of the issue, and it's no longer being unaddressed. Now, how we address it and how we continue to go ahead and ensure that it stays as a top priority, that's going to be a responsibility that we all have. But I do believe there's an expectation between, just as an example earlier that I had indicated, the pharmaceutical companies is being held accountable, right? Mm-hmm. Forget about the lawsuits and things of that nature, but they can no longer just go ahead and say, oh, it's not going to be addicted. There's measures being taken to how we might have gotten here, and stigma has been removed. And like Mike had said, the fact that elementary schools are taking it upon themselves to allow educational tools to be spoken about versus this doesn't happen to us, or this is something that we can't speak to because they're too young. Nobody is ever too young. So I'm hoping that between the change of stigma and everybody having it on their radar, that this is something that needs to be addressed within time. Those numbers that you had mentioned earlier in our at the beginning of the podcast will definitely be going lower and lower.
Michael, a final thought from you on your hopes for the future.
I hope that we continue to be able to have a platform to educate people so that this, although it's an issue that I believe will never go away, because not just substance abuse, we're talking about mental health also. This is something that needs to be treated. The stigma being lifted is amazing, but the accessibility and removing the barriers for treatment is what we focus on more than anything else. And it's stuff like this. I mean, I thank you for this opportunity to have a podcast to be able to talk about this stuff. The more people that are educated and are aware, the better it is for everybody.
Mark Gold, Michael Silberman, thank you so much for partnering on this, for being here with us today, for doing what you do every day, and helping this country heal, really, at the end of the day. Thank you so much.
Thank you, guys.
Thank you for having us.
Thank you.
That is Mark Gold and Michael Silberman. They are the CEO and the COO of Amatus Health, a nationally accredited leader in substance use and mental health treatment, a growing company, 13 locations, 6 states, and the District of Columbia, all in the last 3 years. That'll conclude our podcast today. We do thank our sponsor, Nemphos Braue. Be well, be safe, and we'll meet again soon on Facebook Live. Thank you so much.
Thank you.
Thank you.